I'm very pleased to have the opportunity to speak on this debate today. Over 200,000 people in Wales live with diabetes, with over 500,000 people at risk of developing type 2 diabetes. On those figures alone, we should all be taking an active interest in this area of health and introducing the changes that we need to see to reduce the burdens on the wider NHS. I was honoured to sponsor an event earlier this month for Diabetes Cymru to highlight the importance of delivering improvements for people with diabetes who have poor mental health and well-being. The event brought together medical professionals from across Wales and provided an opportunity for policymakers to listen to these experts on what we should be doing to address the pressures facing our National Health Service and helping our constituents who struggle with diabetes. The event was to launch the campaign Missing to Mainstream to call for specialist psychological support for those living with diabetes in Wales. The need for psychological services was recognised in the Welsh Government's most recent Diabetes Delivery Plan 2016 to 2020, with an estimated 41% of people living with diabetes in Wales are believed to have poor psychological well-being due to the challenges they face on a daily basis living with diabetes. The Welsh NHS currently sets itself no measurable targets for how much psychological support is delivered to those who suffer with long-term conditions. The amount of service delivered across the country also varies hugely, and this is something the Welsh Government must address sooner rather than later. For those of you who attended the event, you will remember that poignant contribution from a sufferer of diabetes and the pressure and the management it placed on his mental health. We should listen to Diabetes Cymru, who are calling for the funding for psychological specialists for diabetes patients. The initial cost of the specialist professionals is minimal and would soon be recouped with the savings from emergency diabetes interventions and emergency medical health support for people at crisis point. Deputy Clywedd, I think it's time for us to put the patients first and ensure we invest properly in diabetes care in Wales, both to address the physical and emotional effects of people suffering with diabetes. As somebody said at that event, people are dying because we are doing nothing. So I would urge colleagues to support the motion today, and as I said, let's put the patient first. Diolch, Deputy Clywedd.
I call on the Deputy Minister for Mental Health and Wellbeing, Lynn Eagle.